So good morning to all. So today we are going to discuss about HBNC. So what is HBNC and why the government of India they brought this program into existence? Okay, so HBNC, the full form of HBNC is home based newborn care. The reason why it came into existence was India contribute 1/5 of the global live birth and more than a quarter of the neonatal deaths. Then about 7.6 infants die within the first 4 weeks of birth in India, which is highest in the world. And the neonatal mortality rate in the rural areas is more than the double of the urban areas. So to overcome those burdens of newborn deaths in first week of life and reach the unreached, the government of India adopted a strategy, and the strategy is known as home-based newborn care. Okay, so what is home-based newborn care? So it is a scheme of government of India. Obviously, the scheme has been under implementation across various states of the country since 2011 as one of the key component of newborn care continuum. So the purpose of these guidelines were to enable the state to develop and operationalize a strategy to ensure that all the newborns are provided home-based care through a series of visits by ASHA worker to ensure that she has the skill and to support to do so. Means it's not only like that ASHA will do the visit, she should have the skill to carry out the care. So everyone of us we know about Janani Suraksha Yojana and Janani Shishu Suraksha Karyakram. So together with these two programs JSY and JSSK, the HBNC they ensure that mother and the newborn have access to the services in order to ensure positive health outcomes. So who are the provider? Anganwadi worker, ANM, medical officer and ASHA. But ASHA is the main vehicle to provide HBNC because she is the native residence of the patient village and always available. She is equipped with all the required skill and to support to provide such type of care. And as a finding, ASHA is more likely to go to the postpartum families and to the newborn families than ASHA and then Anganwadi workers. And ASHA is guided and supported by the healthcare system, which is directly responsible for newborn and child survival. So the objectives. So the objectives of home-based newborn cares were the provision of essential newborn care to all the newborns and the prevention of complication. So the first objective was to provide essential newborn care to all the newborn and the prevention of complication. Next one was early detection. So early detection and special cases of preterm and low birth weight of newborn. So it should be early detected, then only we can prevent the consequences, the complications. So early detection was another objective of home-based newborn care. Next one is early identification of illness in newborn and a provision of appropriate care and the referral. So if we can early identify the illness, we can save the life of newborn. The next one is to support the family for adoption of healthy practices, build confidence and the skill of the mother to safeguard her health and that of the newborn. So if the mother they will take care of themselves, then only they can take care of their babies. So these were the objectives of home-based newborn care. So next come to the key activities of home-based newborn care. What are the activities they used to carry out? So care for every newborn through a series of home visits by ASHA in the first 6 weeks of life. So we have to remember the first 6 weeks of life. Then information and skill to the mother and the family of every newborn to ensure better health outcomes. Examination of every newborn for prematurity and low birth weight. Extra home visits for preterm babies and low birth weight babies by ASHA, ANM and maybe the Anganwadi workers with appropriate care as defined in the protocols. So next one is early identification of illness in newborn and provision of appropriate care at home or referral as defined in the protocol. Follow up for sick newborns after they are discharged from the facilities. Facility means maybe healthcare facilities, maybe hospitals. Counseling of the mother on postpartum care, recognition of the postpartum complication and if needed referral. Counseling of the mother for adoption of appropriate family planning methods. And the skill needed by the ASHA in the provision of home-based newborn care. So what are the skills they need? First one is mobilize all pregnant mothers to ensure that they receive the full package of antenatal care. Undertake the birth planning and the birth preparedness with the mother and the family to ensure access to the safe delivery. So now let's discuss about the activity of ASHA they used to do during their home visit. First, they used to do with measurement of the children, with measurement of the newborn, then measuring the newborn temperature, ensuring warmth, means they used to advise the mother to keep the baby warm, then supporting exclusive breastfeeding. Here what they can do, they used to advise the mother and they used to explain the mother about the importance of exclusive breastfeeding, then diagnosis and counseling in case of problem with breastfeeding, and they can also teach the mother about the proper methods of breastfeeding, then promoting hand washing means promoting cleanliness, then providing skin, cord and eye care, then health promotion and counseling to the mother and as well as to the family members. After assessment, if ASHA they got any low birth weight baby or preterm baby, so they have to use their protocols under HBNC and manage those cases. How they used to manage those cases? By increasing the number of home visits, monitoring weight gain, supporting and counseling the mother and the family to keep the baby warm and enable frequent and exclusive breastfeeding. And they can also advise and teach the mother about how to express the breast milk and they can feed the baby with cup and spoon. Recognize postpartum complication in the mother and refer appropriately. Postpartum complication, if they recognize any kind of postpartum complication, for example infection, fever, any kind of postpartum complication, they can refer the mother appropriately and counsel the couple about the appropriate family planning methods. Then use the checklist for first visit to the newborn and home visit form to remind her and to ask the key question and ensure that she follows the step of examination and counseling the mother. Provide immediate newborn care in case of those deliveries that do not occur in the institution, for example home deliveries and deliveries occurring on the way to the institution. So now come to the schedule of payment. So in the schedule of payment, in case of institutional delivery, the ASHA they have to do 6 visits, day 3, day 7, day 14, day 21, day 28 and day 42. In case of home delivery, they have to conduct 7 visits, day 1, day 3, day 7, day 14, day 21, day 28 and day 42. In case of cesarean section, they have to conduct 5 visits, day 7, day 14, day 21, day 28, day 42. In case of SNCU, Sick Neonatal Care Unit, the ASHA are eligible for an incentive of Rs 250 for the completing of the remaining visit. After the baby getting discharged from SNCU, the ASHA they have to go and visit the children. So for each visit they will get Rs 250. In addition, the ASHA are eligible for an incentive of ₹50 for monthly follow-up of low birth weight and newborn babies ditches from SNCU, and the low birth weight babies follow up to 2 years, and SNCU baby they have to do the follow-up up to 1 year. So the monitoring, who is to do the monitoring of home-based newborn care? The process of implementation of home-based newborn care program will be closely monitored by the Ministry of Health and Family Welfare on a quarterly basis. State will be required to provide details of the status of ASHA training and equipment related to home-based newborn care, along with details of home-based newborn care visits and referral made by ASHA and total expenditure on home-based newborn care by the state. So these are some sample registration form of home-based newborn care. Then the content of ASHA kit to facilitate home-based newborn care, equipment, medication and consumables. So the equipments, what are the equipment they used to carry in their bag? Digital watch, digital thermometer, neonatal weighing machine, then sling of the weighing scale, blanket to keep the baby warm, and baby feeding spoon. The medication, so these are the medication they used to carry with them. Then consumable, cotton, gauze piece, soap and soap case. I hope you have understood the topic.